Welcome to the training on Occupational Health, Environment and Safety. Let's begin with the module on hemorrhage. Before we begin, let's look at the key learning objectives of this module. After completing this session, you will be able to define hemorrhage, explain the causes of hemorrhage, explain types of hemorrhage, list signs and symptoms of hemorrhage, and demonstrate the first aid for hemorrhage. Now let's see what hemorrhage is. Hemorrhage is any significant internal or external bleeding from the blood vessels. Rapid and unchecked blood loss may cause shock and even death. Bleeding can occur from any body orifice, such as the mouth, ears, or anus. It can occur as a result of any distress caused by a deep cut or wound. Now let's find out the different types of hemorrhage. Click on each image to know more. Minor bleeding. These result from small wounds and the amount of blood loss is not considered dangerous. In addition, the bleeding stops on its own without the need for medical intervention. Major bleeding. Severe traumatic bleeding is a greater cause for concern. If the bleeding is not stopped, and the wound is not tended to, the person can die within a few minutes from loss of blood. External bleeding. This is characterized by blood flowing from orifices that are naturally found in the body, such as the ears, nose, mouth, urethra, vagina, or anus. Internal bleeding. Internal bleeding occurs when an internal organ starts bleeding. Immediate medical attention is needed in these cases. Common internal hemorrhages occur in the arteries, veins, and capillaries. These hemorrhages are difficult to control and are often life-threatening. There are various causes that can lead to a hemorrhage. The most obvious cause of hemorrhage is trauma or injury to a blood vessel. Weak spots in the artery wall that are often present at birth can cause hemorrhage. Hypertension or high blood pressure contributes to brain hemorrhage. This can cause a stroke. Uncontrolled diabetes can weaken blood vessels and cause hemorrhage. Bleeding disorders and medication also can cause hemorrhage. Some of the symptoms of internal bleeding are abdominal pain, chest pain, external bleeding through any natural opening, blood through various excretory tract like blood and stool, urine or vomit, vaginal bleeding, changes of skin color several days after an injury. What is the first aid for a hemorrhage? First aid can be given only for major external bleeding. Minor bleeding only needs to be washed with an antiseptic lotion such as Dettol and covered with a bandage. Internal bleeding needs immediate medical attention. Now click on the images to know more. Help the injured person to calm down and lie, thus increasing blood flow to the brain and reducing chances of fainting. Cover the person to prevent loss of body heat. If possible, position the person's head slightly lower than the trunk or elevate the legs and elevate the site of bleeding. But in case of head injury, remember the head should be elevated than the trunk. Wear gloves and remove any obvious dirt or debris from the wound. Don't remove any large or more deeply embedded objects. Your principal concern is to stop the bleeding. Apply pressure directly on the wound until the bleeding stops. Use a sterile bandage or clean cloth and apply continuous pressure for at least 20 minutes, without pausing to check whether the bleeding has stopped. Maintain pressure by binding the wound tightly with a bandage or clean cloth and adhesive tape. Use your hands if nothing else is available. If possible, wear rubber or latex gloves or use a clean plastic bag for protection. Don't remove the gauze or bandage. If the bleeding continues and seeps through the gauze or other material you're holding on the wound, don't remove it. Instead, add more absorbent material on top of it. Immobilize the injured body part once the bleeding has stopped. Leave the bandages in place and get the injured person to the emergency room as soon as possible. If you suspect internal bleeding, immediately call your local emergency number.
How to stop bleeding. You will need disposable gloves, sterile gauze pads or cloth, bandages, adhesive tape, bandage clips or safety pins, soap, and water. Step 1. If they are available, put on a pair of disposable gloves. Step 2. Help the victim lie down and elevate the body part that is bleeding. If it is possible to raise the part above the heart, this will help slow the bleeding. Step 3. Remove or clean anything that's in or near the wound that you can remove or clean easily, including clothing or jewelry. Step 4. Cover the wound with sterile gauze pads or cloth and press firmly against the wound. Keep the pressure steady and consistent. If a foreign object is causing the bleeding, such as a knife or a piece of wood, do not remove it. It may be keeping the bleeding under control. Try to keep the object and injured area still, placing the dressing around the object and pressing lightly against the wound. Step 5. Wrap a clean bandage around the wound and secure it with adhesive tape, bandage clips, or safety pins. If blood soaks through the bandage, apply another bandage over the first one. Step 6. Continue applying pressure either with your hand on the dressing or with the bandage for at least 15 minutes. Do not check to see if the bleeding has stopped before the time is up. Step 7. If the flow of blood has not slowed or stopped after 15 minutes of steady pressure, call 911. Step 8. If the bleeding does not stop, squeeze the artery that supplies blood to that limb or area against the bone. Maintain direct pressure on the wound and direct pressure on the pressure point until help arrives. To find the artery on an arm, press midway between the shoulder and the elbow on the inside of the arm. To find the artery on a leg, press against the crease where the inside of the thigh meets the groin. Step 9. Carefully remove your gloves, being sure not to come into contact with the blood. Step 10. Wash your hands thoroughly with soap and water once you're done tending to the bleeding. Did you know the arteries that supply your arms with blood are called the brachial arteries? Those in your leg are called the femoral arteries.